Have you ever woken up with the feeling that something just isn't right? Not pain, not tiredness, just a strange, unexplained sensation in your body? Sometimes it's those early morning sensations, the ones we often blame on age or sleeping in a bad position, that can be the very first warning signs of serious conditions, including cancer. Today we'll go over 7 such signs, and more importantly, we'll talk about what you can do about them. No fear tactics, just care and support. One early sign that people often brush off is morning nausea, but I'd like you to look at it a little differently today. When you wake up feeling slightly sick to your stomach, especially without having eaten anything that might explain it, it's easy to think it's just age, nerves, or maybe a side effect of medications. But here's the truth. In some older adults, persistent nausea first thing in the morning can be your body trying to flag something deeper, like early issues with the pancreas, liver, or even changes in brain chemistry. That doesn't mean you should panic. It just means your body is asking for a little attention, and that's never something to ignore. I'll tell you why I take this symptom seriously. A few years back, I was working with a patient named Bob, 72, from a small town in Ohio. He came in for a routine checkup and casually mentioned he had been waking up feeling a bit off for the last few weeks. At first, he thought it was just the stress of helping his wife through her own health issues. Probably just nerves or not sleeping well, he said. But I asked a few more questions and found out he'd also lost a few pounds without trying and wasn't as hungry in the mornings as he used to be. I recommended an abdominal ultrasound, not because I expected anything urgent, but just to be thorough. What we found was a small lesion on his pancreas. It was caught early, and with treatment, Bob's prognosis turned out much better than it would have if we had waited, and he wasn't alone. I've had patients like Diane, 69, from Arizona, who thought it was acid reflux, or Gerald, 75, who blamed his nausea on his morning coffee. In a few of these cases, further tests helped catch something that could have gone unnoticed for months. What often helps in situations like this is simply tracking the pattern. If nausea appears regularly in the morning for more than a week or two, especially if it's joined by fatigue, poor appetite, or weight loss, make an appointment to discuss it with your doctor. A basic GI workup, some blood work, and perhaps an ultrasound can bring real clarity. It's not about assuming the worst. It's about giving yourself the best shot at early answers. And if I can leave you with one thought, it's this. Your body speaks quietly at first. You don't have to wait until it shouts. Taking small concerns seriously isn't overreacting, it's wisdom. You've earned the right to feel good in the morning. Don't settle for just getting by. Even small steps toward clarity can open the door to years of better health and peace of mind. Here's another early morning symptom I want you to pay close attention to, a sense of heaviness or pressure in the chest that shows up after sleep. Now, most people over 60 are quick to assume it's just the position they slept in, or maybe something they ate the night before. And yes, sometimes it really is just that. But when that discomfort keeps coming back, when it lingers for several days or shows up even after a restful night, it can be your body's way of telling you something more serious is going on. In some cases, that morning pressure isn't about your heart. It can actually be caused by something pressing on the chest from the lungs or lymph nodes, including early-stage tumors or inflammation. You deserve to feel comfortable waking up. And if you don't, it's okay to ask why. I remember working with a woman named Linda, 69 years old, from Tucson, Arizona. She told me she started waking up with what she described as a brick on her chest. At first, she thought it was her mattress, so she bought a new one. When that didn't help, she tried sleeping upright, assuming it was reflux. But that heavy feeling just wouldn't go away. It wasn't sharp pain, and she wasn't short of breath, so she didn't think it was anything urgent. But something about the way she described it made me dig a little deeper. We ran some routine tests, including a CT scan. It revealed a small mass in her upper chest, pressing on surrounding tissue. Thankfully, it was found early and could be treated effectively. A few months later, Linda sent me a thank you card and said, I would have kept sleeping through it if no one had listened. I've had other patients like Walter, 72, from Michigan, who had similar symptoms and brushed it off as old age until his son pushed for a second opinion. These aren't rare stories. They're just often missed. One of the simplest and most helpful things you can do is track your symptoms for a full week. If you feel chest pressure in the morning for 5 or more days, even if it's mild or fades after breakfast, make an appointment. Let your doctor know exactly when it occurs and how it feels. You may be offered a chest x-ray or scan, and that's not overreacting. That's being smart. That's giving your body the attention it's asking for. The truth is, your body is wiser than you think. It doesn't try to scare you. It tries to warn you early. That feeling in your chest isn't always something bad, but if it keeps knocking, it deserves an answer. You don't have to live with daily discomfort. You're not meant to guess. You're meant to be supported. Solutions often start with listening to yourself. Even a small act like making that call could be the beginning of many healthier mornings ahead. Here's another subtle change that many older adults ignore: a sudden loss of appetite in the morning. You might notice that you're just not as hungry as you used to be when you wake up, or maybe the thought of breakfast feels like a chore instead of a comfort. And sure, it's easy to chalk that up to age, slower digestion, or simply not moving around much early in the day. But here's the thing. In people over 60, a drop in morning appetite, especially if it lasts more than a few days, can sometimes be a sign of changes happening deeper in the body, including the early stages of cancer in the stomach, liver, or ovary. They ever scream, and if something just doesn't feel right day after day, it's worth paying attention. I once worked with a man named George, 74 years old, from Tallahassee, Florida. He'd been my patient for several years, and he was the kind of guy who never missed a routine. Every morning, like clockwork, he had a bowl of oatmeal with blueberries and a little cinnamon. Then one day during a checkup, his wife mentioned almost in passing that he hadn't eaten breakfast all week. George just shrugged and said, "It doesn't appeal to me anymore. Maybe it's just my age." But when I asked a few more questions, I found out he'd also been feeling a little weaker than usual and had dropped 5 pounds in a month without trying. That's when I ordered a few basic tests, including blood work and an ultrasound of the abdomen. The results showed early signs of a liver issue, and further scans revealed a small mass. Fortunately, we caught it early enough that treatment options were strong and outcomes hopeful. George was lucky, but it wasn't luck alone, it was that one small change his wife noticed that made the difference. I've had patients like Dolores, 68, from Indiana, who thought her lack of appetite was due to grief after losing her sister, but it turned out her body was trying to get her attention, too. The key in both cases was listening before it became serious. One of the easiest things you can do if you notice your appetite has dropped is to jot it down daily. How you felt in the morning, what you ate or didn't eat, and any other symptoms, like fatigue, bloating, or weight change. If that pattern lasts for more than 5 to 7 days, bring it to your doctor's attention. A simple blood panel or abdominal scan might provide answers, and in some cases, peace of mind. This isn't about overreacting, it's about noticing patterns and giving your body a voice. And if you're feeling unsure about whether it's worth mentioning, let me gently remind you, your health is never a burden and your instincts are often smarter than you realize. You deserve to feel nourished and strong in the morning. Skipping a few meals now and then might seem harmless, but consistent loss of appetite can be your body's way of saying, "Help me out here." Even a small check-in can open a big door to healing. You don't need to push through discomfort or write things off as just getting older. You deserve answers, and you're allowed to ask for them. Let's take a closer look at something many people assume is harmless: waking up drenched in sweat and feeling wiped out even after a full night's sleep. It might sound familiar. You go to bed comfortable, maybe even a little chilly, but sometime during the night, your pajamas and sheets get soaked. Then morning comes, and instead of feeling rested, you feel like you've run a marathon in your sleep. Now, occasional night sweats can be linked to things like room temperature or a heavy blanket, but if this keeps happening several nights in a row, and if it's paired with low energy in the morning, that could be your body's way of flagging something more serious. For older adults especially, persistent night sweats and fatigue can be early signs of blood cancers like lymphoma, or related to hidden infections or hormonal shifts. Your body isn't trying to scare you, it's trying to signal you. I remember a woman named Margie, 66 years old, from Santa Fe, who came to see me for what she thought was postmenopausal symptoms. She said, "I thought I was done with hot flashes, but lately I wake up soaked and I'm exhausted until noon." Her first instinct was to blame the bedding or the dry air, and honestly, so did her primary doctor at first. They even tried changing her hormone patch, but after a few weeks of no improvement and continued weight loss, her son, who happened to be a nurse, pushed her to get some blood work done. When the tests came back, they showed signs of a possible lymphoma. The diagnosis was scary, yes, but they caught it early, and that changed her entire outlook. She wasn't alone. I've seen similar stories from patients like Harold, 71, who thought it was just the mattress, or John, 69, who tried 3 different fans before finally getting checked. These aren't rare cases, they're just easily missed. What often helps in these cases is asking for a complete blood count and basic hormone screening, especially if the sweating lasts longer than a week and comes with unexplained tiredness. It's a simple thing you can request from your doctor. No need to guess and no need to be embarrassed about bringing it up. What seems like a small symptom can be the first clue to something you can actually address. I always tell people, your body is like a smoke alarm. It doesn't go off for no reason. You're not overreacting by checking in on something that doesn't feel right. In fact, that's one of the strongest things you can do for yourself. It's not weakness, it's wisdom. You deserve rest that leaves you energized, not worried. And sometimes the road to feeling better begins with listening to what your body has been quietly trying to say all along. Another morning change that's easy to miss, but important to notice, is when the whites of your eyes or your skin start looking slightly yellow. Now, I know that sounds dramatic, and many people brush it off as bad lighting or maybe just being tired, but I want you to know that even a faint yellowish tone can be your body signaling trouble with your liver, gallbladder, or bile ducts. In older adults, the ability to process waste products like bilirubin slows down, and when something's not draining properly or a blockage forms, that yellow color is often one of the first signs. It's not always painful, and it doesn't always come with other symptoms at first, which is why it's so easy to miss. But that small shift in color, especially in the early morning when your body hasn't moved much, can be a quiet alert that needs attention. I remember a man named Thomas, 70, from Charleston, South Carolina. He came in for something completely unrelated, just a routine blood pressure check. But during the visit, I noticed a faint yellow tint in his eyes. He said he'd noticed it too, but thought it was just the way the light hit the mirror in the mornings. I asked if anyone else had mentioned it. He said, "Well, my granddaughter asked if I had mustard in my eyes, but I figured she was being silly." That moment stuck with me. We ran a quick liver panel and found that his bilirubin was elevated. A follow-up ultrasound showed a growth pressing on his bile duct. Because we caught it early, he was able to get treatment before symptoms, like pain or fatigue, ever showed up. I've seen the same pattern in other patients, like Irene, 67, from Oregon, who thought her skin looked dull until her daughter noticed it wasn't just dull, it was yellow. These moments matter, and they're often easy to overlook unless someone speaks up. One of the simplest and most powerful steps you can take is to check your reflection in natural light in the morning, or better yet, ask someone you trust, a partner, friend, or family member, if they notice anything different about the whites of your eyes or your skin tone. Often, these small visual changes are easier for others to catch. If anything looks off, a basic liver function test is a good next step, and it's something your doctor can order quickly. I always say this: your body's not trying to scare you, it's trying to help you. You've got a built-in dashboard, and your skin and eyes are part of it. Don't be afraid to look closely or ask someone to take a second look. You deserve to catch things early. And sometimes one careful glance in the mirror or a granddaughter's comment can change the course of your health for the better. Let's talk about something that often gets brushed off: a morning cough that just won't go away. So even though you're not sick, you might wake up needing to clear your throat or feel a tickle deep in your chest first thing and think it's just dryness or leftover from a past cold. But if that cough sticks around for more than a couple of weeks, especially if it happens regularly when you wake up, it's worth looking closer. For older adults, particularly those with a history of smoking, even if it was years ago, a persistent morning cough without other cold symptoms can sometimes be an early sign of lung cancer or chronic inflammation in the lungs. The body clears itself more slowly with age, and if there's something irritating your airway day after day, it might not be nothing. It might be your body waving a little red flag. One of my patients, Dolores, 68, from San Diego, hadn't smoked in over 20 years. She considered herself healthy, active, and walked daily with her neighbor. But for almost a month, she told me she had a dry cough that only seemed to show up in the mornings. She didn't feel sick, had no fever, and figured it was either dust or just aging lungs. Her family wasn't too concerned, except for her son-in-law, who worked as a paramedic. During a weekend visit, he heard her cough and told her, "That doesn't sound right." He gently encouraged her to get a chest x-ray, just to rule things out. She did, and what it revealed was a small lesion in the upper lobe of her right lung. Because they caught it early, her treatment options were good, and her outcome positive. I've seen this story before too. George, 72, who thought it was allergies, or Myra, 74, who blamed the fan by her bed. Sometimes it's nothing, but sometimes it's the beginning of something that needs our attention before it gets worse. 1. Of the most helpful steps you can take if you notice a lingering morning cough, especially one without mucus or other cold symptoms, is to track how long it's been happening and talk to your doctor if it lasts more than 2 weeks. Ask specifically for a chest x-ray or CT scan. These are quick, painless, and often give answers that can either reassure you or guide you to the next step early. What I want you to remember is this: you don't need to wait until something feels serious to take it seriously. A small sound from your lungs each morning might feel like no big deal, but it could be the very clue that helps you get ahead of something bigger. Listening to your body doesn't mean you're overreacting. It means you're taking care of what matters most: your time, your comfort, and your future. One more symptom I want to gently highlight is something many people your age quietly accept: deep aching pain in the bones or joints first thing in the morning that doesn't go away after you get moving. Now, a bit of stiffness is common as we get older. Cartilage wears down, joints lose some of their cushioning, and we tend to sleep in one position for too long. But if you're waking up feeling like your whole body's been hit by a truck, and that pain doesn't ease up after a warm shower or a walk around the house, it may be more than arthritis or just aging. In some cases, especially if the pain is in one specific spot or keeps you from doing everyday tasks, it can be a warning sign of something more serious, like bone metastases or even multiple myeloma, a type of blood cancer that affects the bone marrow. That's why it matters not to push through pain without asking where it's coming from. I think of Helen, 73, from Cedar Rapids, who came in last winter with what she called a tired body. She described her mornings as brutal. It felt like her hips and lower back were locked up, and the ache stayed with her until lunchtime. She assumed it was arthritis or maybe sciatica, and so did her previous provider. She was prescribed a basic anti-inflammatory and told to stretch, but when things didn't improve and the pain in her lower back became sharper, I suggested an MRI. The results showed bone lesions related to a blood disorder we later diagnosed as early-stage myeloma. It wasn't something she ever imagined, but because we caught it before it progressed, she was able to begin treatment right away. Another patient, Sam, 70, in Ohio, had similar pain in his shoulder blade and wrote it off to his old baseball injury, but scans showed the same pattern. That's why I tell people not to ignore pain just because they're used to it. If it lingers and isn't tied to movement or injury, your body is likely trying to tell you something important. What often helps in situations like this is to track the exact location and time of the pain for 7 to 10 days and bring those notes to your doctor. If the discomfort sticks around, especially if it's in the same area every morning, ask about a CT scan or MRI. These imaging tools can detect changes that X-rays might miss and give you answers instead of assumptions. Pain doesn't make you weak, and speaking up about it doesn't make you a complainer. In fact, being honest about what you feel, especially when it's hard to put into words, is one of the strongest things you can do for yourself. Your mornings should be a fresh start, not something you dread. And even if you've lived with discomfort for a while, it's never too late to ask, could this be something more? You're not overthinking. You're advocating for the life you deserve. If even one of these signs feels familiar to you, don't wait. Share your thoughts in the comments. Your story might help someone else. Give this video a like if you found it helpful. Subscribe to the channel so you don't miss future videos. Each one is made with heart just for you. You're not alone. You're stronger than you think, and life goes on when you hold it by the hand.